opposed? The minutes are approved. Thank you so very much for coming, Dr. Norm Christopher. We appreciate the time that you're taking today. I realize you couldn't come last week, but we really appreciate you coming today. I will again turn it over to our Health Equity Ambassador, Mrs. Tamika Rose, to introduce the panel, and I'll let you move through the speakers.
Okay, well, thank you, Councilwoman Amobi and members of the Health and Social Services Committee. Today we have Dr. Norm Christopher from Akron Children's Hospital, Corey Kendrick, and Donna Skoda from Summit County Public Health to talk to you again about Tobacco 21. I hope that we have answered your questions and concerns, and we look forward to the discussion today. I'll turn it over to Dr. Christopher.
Thank you. Please.
Thank you. I appreciate the opportunity to be here today with the committee, Chairwoman Amobi and the members of the Health and Social Service Committee. It's a real pleasure and an honor to be a part of this important process. As said, I'm Dr. Norman Christopher. I'm a pediatrician. I'm the chairman of the Department of Pediatrics at Akron Children's Hospital, and I'm a member of the American Heart Association's Board of Directors for Summit and Portage Counties. It's in that capacity that I come to you today. It's an honor and a pleasure to be here. I appear before you this afternoon to urge adoption of the local ordinance that would raise the legal minimum age for the sale of all tobacco and nicotine products to 21 years. Tobacco use continues to be a significant public health concern and is a leading cause of preventable death in the United States. There is no safe level of tobacco exposure in children, and remember that tobacco is unique among consumer products in that it causes disease and premature death even when used exactly as intended. Though important progress has been made, still 1 out of every 7 Ohio high school students self-report that they smoke tobacco, and that's compared to 11% nationally. We're above the national average here in the state of Ohio. Because of nicotine's addictive nature, any pathway that contributes to experimentation or initiation of tobacco use among our young people should be eliminated. We know that nearly 90% of adult smokers had their first cigarette before their 21st birthday. We also know that those who delay initiation of smoking beyond the age of 21 years are unlikely ever to smoke. Adolescence is also a critical period in growth and development, one during which the nervous and cardiac systems are especially vulnerable to the effects of nicotine and other toxins. In Ohio, more than 7,000 children under the age of 18 become new daily smokers. Tobacco use has deadly consequences. Early signs of heart disease and stroke risk are present in young people who smoke even 1 cigarette each day. Of every 3 young smokers, 1 will eventually die of a smoking-related illness. Furthermore, smokers die on average more than 10 years earlier than non-smokers, and for those who require hospitalization for any reason, smokers experience longer lengths of hospital stay and higher medical costs than do non-smokers. In addition, the use of tobacco during pregnancy carries with it a higher risk for prematurity or for small for gestational age newborns. Each of these contributes substantially to the very high and very troubling infant mortality rates in Summit County and throughout the state of Ohio. Pregnancy in girls less than 21 years of age is by definition high risk, and is especially so in young women who smoke during their pregnancy. Let me add that I'm pleased to see that electronic nicotine delivery systems are included within the scope of the ordinance. Earlier this year, a study conducted by Dr. Rubenstein and colleagues at the University of California extended upon what we already know about the dangers of vaping in adolescents. I did provide that for you in the packet of material, that most recent publication. Although e-cigarette vapor has long been marketed as being less hazardous than tobacco smoke, the findings of this NIH-funded study challenges the idea that e-cigarette vapor is safe or innocuous. Dr. Rubenstein's study shows that in addition to nicotine, at least 5 other carcinogenic toxins are excreted in the urine of teenage users, and that was the study design that was implemented to demonstrate that. Also included for your later review are copies of the American Academy of Pediatrics policies titled Public Policy to Protect Children from Tobacco, Nicotine, and Tobacco Smoke, and Electronic Nicotine Delivery Systems. To exempt or carve out these devices from the ordinance would significantly diminish its intent, with potentially devastating effects in our community. It is a reasonable assumption that if vaping products are excluded from Tobacco 21 legislation, that the industry would intensify its efforts to market vaping products as a safe alternative to the under 21 population. This would result in an increase in the marketing, sale, and use of these products in children at high risk. For that reason, I respectfully request that electronic and vaping devices be kept within the definitions and scope of the ordinance. Raising the minimum age for tobacco sales can delay the number of youth who start smoking. This would lead to lower smoking rates and would save millions of dollars in healthcare costs. Of course, many of the benefits would not be realized immediately, as the impact would be on longer-term effects of smoking rather than just on the immediate and short-term effects. Across populations, it would significantly increase not just the length, but the quality of people's lives. To be successful, however, youth access laws must be rigorously enforced. The committee understands that the most effective way to ensure compliance is to take enforcement into account when drafting the ordinance, rather than as an add-on or a consideration after the proposal has been adopted. And so for these reasons, I urge the committee and the council in their leadership position to vote in favor of the Tobacco 21 ordinance with enforcement measures. Thank you again for the chance to be here this afternoon to share some of my thoughts, and of course I'm happy to answer any questions that you might have. Thank you.
Thank you, Dr. Christopher. I don't know, we've had a week. Mrs. Scotto, Commissioner Scotto, I don't know if you had anything else you'd like to add or Cody?
Is this on?
Yes.
Okay, good. Okay, thank you. Actually, we came today with some items. Maybe we could talk a little bit about some of Veronica's questions that you had last week that we answered about. Certainly, the intent of this is to keep kids from ever getting that first cigarette. And one strategy is to remove those 17, 18, 19-year-olds from their peer groups, because many children don't, 21-year-olds don't hang out with high schoolers. And then that's usually how they get their first cigarettes, is somebody gives those cigarettes to them. Across the country, there's been good literature that says if you can keep kids from getting those first cigarettes and never starting to smoke, that it goes a long way and that they won't start smoking. You know, we heard a pediatrician say that, you know, people start before they're 21 years of age, and we know that to be true. And the problem with starting is it's very difficult then to quit. And we also know that, and it has huge impact on their lives. I mean, there's other retail strategies I guess we could consider. I mean, you look at what other communities have done. I mean, anything that makes it more difficult, but this one is fairly simple to begin and to implement, and yet it doesn't take a great deal of cost. If you look at New York City, I mean, they just raised the price of cigarettes to what, $14, $15 a pack? And the price dropped. People quit smoking because they couldn't afford it any longer. I mean, there's things that you can do there, but anything that controls youth access is a best proven standard according to the Centers for Disease Control, and that's what we're after here. And I think when we spoke with Ms. Sims, some of her concerns, you know, and legitimately so, this is about keeping kids from smoking, getting kids start smoking. There's no other hidden agenda. We inspect, we're a health district, we believe in prevention. And often we have to do things that aren't really popular sometimes. People think that we're denying the rights of others, but we deny the rights only for the good of all. And when you look at fluoride in the water, you could still talk to folks who thought fluoride was going to poison us, but you can thank fluoride as to why you don't have as many cavities in your mouth. Fluoride was a huge public health effort to protect children's teeth, which it's done a mighty good job. We also look at vaccine for school age to protect the larger group. I mean, sometimes we have to do things, and it's tough, but it really is for the common good. There's no hidden agenda. It's for the better good. And so I'd be glad to answer any questions as well. And we did, again, in conversation with Ms. Sims, talked a lot about, you know, we put these rules in, but a big piece of this for the first 6 to 7 months is roll out education and, you know, signage and giving folks what they need to be successful. You know, it's not about going in and busting somebody's chops because they're selling cigarettes. It's the idea that they get the education and they get what it's doing to the health of kids.
Thank you very much. I don't know if, Corey, if you had any additional comments?
Just reinforcing what Donna says. I mean, looking at all the available literature, this is one of the most effective strategies, the lowest cost that we can do to try to reduce youth initiation rates. And it's been proven in multiple other cities and statewide in various efforts. So, I wish there was simple policies that we could look at for across other areas that were this effective. And to add on to Dr. Christopher about the electronic cigarettes, I just would like to add again how important that piece is. Looking nationally, about 38% of high school students have tried electronic cigarettes now, which is in comparison to 13% of traditional cigarettes. So electronic cigarettes are now the most common preferred method of smoking for high school students. And in another recent study in the Academy of Pediatrics titled E-Cigarettes, a One-Way Street to Traditional Smoking, students who have smoked e-cigarettes are 7 times more likely to smoke a traditional cigarette the following year by doing e-cigarettes. So there's strong evidence to show that it is a gateway to traditional tobacco and not the other way around, which is interesting findings. In addition, the tobacco industries know this. They've kind of conceded traditional tobacco. And from 2011 to 2014, e-cigarette advertising has increased by $110 million per year to that effect because it's an easier way to market. And another piece of that interesting research that the more harmful toxins are present when it's the flavors, which are most commonly used for high school students. So when they're the fruit flavors, the toxicity level is actually much higher for those carcinogens than in regular vaping liquid as well. So with all those things in mind, what we really want is our children's lungs to only breathe clean air, and that's the bottom line. You could argue, is cigarettes better for you than vaping? Clean air is really the only thing we want in our children's lungs and a brain that's free of addiction. So, thank you.
Thank you very much. Mrs. Rose, did you have any other comments before we take questions?
No, I have no other comments. I think that the panel has done a great job, especially with, I do want to say that the vaping industry did contact me, and that is why you're hearing a lot about the vaping, but I don't think that they've come today. But I wanted everyone to be prepared and hear the arguments against taking it out of the legislation.
Sure.
Thank you.
Thank you very much. I was going to ask if anyone is here for that. But I know we have a process map for implementation. Did you want to walk through that so when we start entertaining questions, we can talk about that as well?
Yeah, sure. So last time I think it was a little bit fuzzy on how this might play out, so we created a graphical representation of how this might work. So this is the document that you're speaking of. And so we have 3 steps, really. First is the local ordinance is enacted. So that's where we're at right now in step 1. And if this ordinance would be enacted, the health department doesn't have the power to inherently register tobacco retailers or assess fines. So what the city would be doing is granting the health department the power to do so. So that would be step 1 and outlines the stipulations with that. Step 2 and 3 is a 6-month time frame where we would, once we had the authority to regulate through that ordinance, we would then have a rulemaking period internally. So this would be no different than when we license food or septic or well or any other many licensing programs we have to establish the rules, and that has to go through 3 readings through our Board of Health and open to the public and all of that due process. Yes, and I'm using the word registration, license interchangeably. It's going to really be what the end ordinance comes out to be.
Sure.
So, but whatever the case, it would be something that the vendor would obtain. So let's just say we're calling it registration for right now. We would then have a program roll out to register to tobacco vendors, along with education and outreach, as well as cessation information and a marketing campaign specifically directed to 18 to 20-year-olds that are currently smoking to provide information on free community resources on how to quit smoking. And then the enforcement process, which I think this is probably one of the biggest confusion pieces of the last time. Enforcement sounds like a heavy-handed word, but it's a process we currently do on all of the things we inspect, whether it be restaurants or parks or pools, anything we currently inspect. So I just want to reinforce the fact that this ordinance will feature no criminal component, and the health department does not or will not have the authority or intention to fine or charge youth, customers, vendors, vendor employees. This will strictly be for the vendors and tobacco retailers in the form of fines. So I just wanted to make that perfectly clear. We would do undercover inspections that would be computer generated. These would not be any targeted inspections. These would be computer generated randomly so that everyone is chosen at random or via complaint. And we have a complaints process that we do now, no different than if someone would say, you know, there was a Band-Aid in my pizza or something. We investigate those allegations, and we have to look at those facts firsthand, just not hearsay. There's a complete process when that happens. So then you'll see an example of how this could potentially work or roll out with enforcement if there was someone who continually was selling to minors, and how that might play out. The first offense would be a warning, and really the goal of this is to not put anyone out of business. We want everyone to be employed. We want the economy to be strong. We don't want to see anyone go out of business. And we do the same thing with all our food vendors. We work very, very hard to make sure they come back into compliance because we don't want to see anybody be out of work. So the first offense would just be a warning, and then thereafter it could be fines, and then potentially reviewing the registration. So that's kind of a high-level overview, and I hope that clarifies a little bit of what the process could be. And I'd like any questions you guys would have.
Sure. Questions? Mrs. Sims?
First of all, thank you, Doctor, for coming in today. And thank you, Commissioner and Corey, for taking an opportunity to meet with me. And let me say, I don't think for any of us there was a thought there was a hidden agenda. But I think as lawmakers, we have to be cognizant of the unintended consequences. To suddenly take from a group of folks something they've had the right to without really having time to really consume all of what we're talking about, I think would be irresponsible for us to vote on those kind of things. I think that by and large, I've been pretty satisfied with the responses that I've gotten. I know we've talked about some other things that I'd like to see in the legislation that certainly is clear on its support of young folks. I think always, for me, and everybody I would imagine in this room, we think smoking is bad. I mean, but you can have great causes, but solutions aren't the right ones. And so making sure the approach that we're taking is really the right solution was my priority. So again, I thank you for your responsiveness and appreciate the time for you all coming out today.
Thank you.
Just a minute. Are there any other committee members with questions? Mrs. Moses Samples.
Thank you. I have a few questions and just some concerns of my own. I first want to thank Ms. Rose for supplying me with the information as it relates to birth outcomes. I appreciate that. The one thing for me that's still missing is how this will be implemented, which is where my concern is. No, I don't want young people smoking. I think it's bad for you. I've never smoked a day in my life, so I don't know what that effect is. But when listening to you all, I'm concerned with, will the health department be now like policing the community? It's my first question. With the city's approval, when I think about what happens when this legislation is brought forth and ultimately passed, You know, I can't help but think about what Councilman Milkovich said, will we be creating a black market here? And when you think about that, we have young people between the ages of 18 and now 20 who will no longer be able to smoke. You know, we've now created a market where they may feel a need to go and buy them from an adult, or even deeper than that, when you go back and you think about Eric Garner, who was choked out in New York for selling loose cigarettes, that concerns me. As someone who represents a community that predominantly looks like me, full of young boys who get pulled over on a regular basis for whatever reason, you know, are we now creating yet another reason to pull them over? Although there's no criminal element to it, if you have an officer who may have an issue with someone who passes them in a car who they know that's not 21 and they have a cigarette, are we now giving that officer a reason to pull them over to say, hey, by the way, did you know that smoking cigarettes is illegal in the city of Akron? Most of these young people aren't going to know that. And so these are just areas that really concern me. Yes, smoking is bad, and I commend you all for your work, and yes, we need to do something about it. It's just hard for me to grasp that, knowing the community that I represent and how it ultimately will affect them, even though we're saying that it's civil and it'll fall back on our store owners. It's hard for me to believe that it's not going to fall back on these young people that live in the neighborhood that I represent. So I really want to really see what that'll look like in that result of who's going to be doing the policing. Are we going to be doing undercover work, going in stores and finding out who's selling to the kids? Are we going to have a young boy on the side of the store selling loose cigarettes, and now we've created another issue? So I just really want to know what that looks like. Again, I appreciate the information that I've been given as far as the birth weights and all that, but again, my concern is the oversight and how this is really going to be handled. Thank you.
Thank you for your question. I'd like to address your concerns. In terms of I'm going to try to go from the way that your question was posed. In terms of the black market, if you think about it right now, one of the reasons that we targeted the 18-year-olds is because some of the 18-year-olds are still in high school.
Right.
So they already have a black market. They purchase the cigarettes, they take them in, and then you have 14, 15, 16-year-olds smoking cigarettes because their 18-year-old friend. This way, we're trying to eliminate the black market that currently exists. And secondly, and I can understand that you may say that that's not what's but that's what we found out in the vaping industry as well. Like, the kids go in, they get the vapes, and then they bring them in. So we have an article of that, and I can share that with you as well. So that is a new black market that's coming up, is those kids they're buying it and they're bringing it into the schools. Secondly, in terms of the police coming to do something as heinous as what happened in New York, the police officers are not supposed to be pulling anyone over for smoking a cigarette in Akron, Ohio. Actually, the law it was a misdemeanor to smoke. That law it's been removed. It's only civil, and it's only directed at the retailers. So there is no charge to be given to that person if they are smoking a cigarette. There's no charge for the actual smoker. So if they are in violation, because there's nothing to charge them with right now if this ordinance passes.
So I get what you're saying, and I understand that part, that there's no criminal element to it, but my concern again is if you have an overzealous officer who has an issue with a young boy that they know that's under 21, and now they see him smoking a cigarette, although it's civil, doesn't mean that they're not going to use that as a means to pull them over. And that's where my concern is. Even when we talk about the vapors now, you know, marijuana is medically legal in the state of Ohio. Now we have another industry that's coming. There will be vapors involved in that. So how do we balance the two? And especially if now we talk about legalizing marijuana recreational, there's going to be vapors involved in that. And so I'm just really concerned about what this is going to look like when we have a whole nother industry that's now moving into Ohio. We get rid of the cigarettes, but the marijuana is coming right behind it. So I just have some great concerns as it relates to that.
Sure, and Councilwoman, just to clarify the police and the criminal aspect of it, the legislation creates a civil penalty for retailers and other entities selling cigarettes to people under 21. And so there is no civil penalty for people possessing or using cigarettes under 21. There's no criminal penalty. So there's no probable cause or anything that can justify a stop. It's just directed at businesses. There's no language in here as opposed to individuals in possession.
And if I could add, please, Madam Chair, Ms. Mosley Samples, the health department is really preventive in nature, and we're very focused on the education piece to it. We have plenty of non-compliant restaurants, but you wouldn't know who they were. We don't try to do any of that stuff. We really try to get folks into compliance and get them to respect the ordinances and rules, because we really want for the safety and welfare of all. And so if a sanitarian went in and saw a kid selling singles, they would not call the police. They would walk out. I mean, that's sort of what we do now for Smoke Free Ohio. We do the enforcement for the state of Ohio. Our sanitarians are as at risk adverse for police powers as they come. We just don't educate them that way or school them that way. They're scientists that are out there for the good of the community, and that's how they're viewed. So those fears I have none of. They would do none of those behaviors. Believe me, you'd hear about a lot more restaurants if they did engage in those behaviors. But that's just not how we operate at all. This is really about youth not getting access to cigarettes, so don't ever start smoking and or vaping products, which leads to cigarette smoke. Thank you.
Thank you, Mr. Neal.
Thank you, Madam Chair. Appreciate the concerns of my colleagues, but I do want to stress what I shared last week, and that is, one, I appreciate this because I do have problems with retailers in the area, and this gives us something to enforce, to make them do what's right. I also appreciate this because in my ward there's a push towards just holistic wellness and a community culture change. So this is the concern that I have, and that is that the demographic that we're talking about be empowered to be a part of getting the message out and creating the change. So many times when we do this, we bring an outside professional marketing group, and we spend dollars that we don't necessarily have to spend. I think if we were ever shown this past weekend how the demographic that we're speaking about right here is mature enough, savvy enough to get a message out and help us bring about the culture change that we want. So my thing is, I want to make sure that as we address the overall concerns that have been shared, that we, and I think that just comes through more conversation. I appreciate the information that was brought for us today, that we look at one, empowering those who we want to be a part of this culture change to help get the message out. So that meaning that the resources for this come to the communities where we see this heavy impact. That's what I'd like to see. But again, I do appreciate giving a tool, because there's been many times I've talked to our community police officers about places selling singles, and if they're selling singles, I can guarantee you that they're not checking an age, so that we can better police that in our community. Yeah, so just want to share that, Madam Chair. Thank you.
Madam President.
Thank you, Madam Chair. Just a question regarding the fines. What will those funds be used for once collected? Do we know?
Support smoking cessation and other kind of activities for the population that we're targeting.
Okay, very good.
Mr. Fesco.
Thank you, Chair. Woman Mobian, again, I just wanted to, the education piece that you continue to bring up is so invaluable. You know, it's if you look back at what the Surgeon General back in the day, you know, started that education, and it started with education, I do believe, at that time. I remember seeing pictures of council many, many years ago, the council members with ashtrays all up and down here. So, you know, it's got to start somewhere, and the education is the best component, and then your enforcement strategy in terms of the point of sale and targeting that piece, I think is a good strategy altogether. And so just appreciate the thoughtfulness in terms of working toward the goal, which everyone's going to benefit at the end of the day. So again, appreciate that. Thank you.
Thank you.
Mr. Mikovich.
Thank you, Madam Chair. And I agree with my friend and colleague, Councilman Fusco. Education is the key component. Mm-hmm. The one thing that I find interesting, out of the two cities in Ohio that have this law, Cleveland, our good friends to the north, they're the ones that have the sin tax, which goes to fund their sports facilities. Mm-hmm. But again, as a smoker, former smoker, I want to appreciate you, and hopefully we can stop those young children from smoking. Thank you.
Thank you.
It is my understanding, I spoke with the law department today, that they are working on the language to tweak it further to make sure that we know exactly what we're delegating to the Summit County Public Health Department in terms of how to carry out the enforcement piece. But personally, I'd like to thank you. I heard about this when Corey presented it to the Summit County our board, SSAB. Thank you, Corey. And everybody around the table was so excited. They wanted to know, can you do something, Linda, since you're on City Council? I said I would love to have it come before the Health and Social Services Committee, and here it is today. Everything about this I agree with. I know that we are struggling now with infant mortality. This is connected to that. Young people don't have the cognitive awareness to think long-term about behaviors that they're engaging in at an early age. I certainly appreciate that piece. And I love the piece about the fact that we're not going after the users. We're trying to make it more difficult for them to purchase the tools to do this. And there's just so much about this that I appreciate now. And I like the thinking that you've gone through. You want to do 6 months of education. But this is just not for the public health department. This is for this entire community. Yes. I was just speaking with the League of Women Voters representative here today that I would like to go and talk with them about how they could be involved, or Junior League or churches, everybody taking on this, because I didn't know what fresh air smelled like until people were not allowed to smoke in places. And not only that, I read in the material that I got last week that 70% of adults who smoke would like to quit, but it's so difficult. And I heard from some of the members of council who talked about the difficulty they had quitting this practice. So everything about it, I think, is good for our community and good for all the communities that would join us in doing this, because we talk about the saving of resources, but we don't talk about the health, those health problems that people have, and we know that there are so many connected to smoking. So I am all in favor of this. I certainly want us to get it right, and I think that's what the law department is working on, to make sure that we do that piece. And it sounds like Mrs. Sims may have some recommendations. Will you give those to the law department? Yeah, we're working on it. And then we will certainly come back. We will be taking time today, is my understanding, until we get the additional information. Are there additional questions? Mr. Kilby, just a moment. But people have already
Real briefly, I mean, I enjoyed the conversation, and I want to thank the panel for coming in, sharing your expertise. I had a couple questions, like what is the existing state of Ohio law when it comes to tobacco? Does this say you have to be 18 to buy that? is there a law against people under 18 smoking cigarettes or using, no? Okay, so this ordinance doesn't create any criminal penalties or civil penalties against a kid under 18 smoking a cigarette, so, but it's an interesting conversation we've had this afternoon. I support this legislation, by the way. I'm not on the committee, but the thing about vaping, isn't there some benefit to vaping and people wanting to get off of cigarettes? I mean, I've heard of people like weaning themselves off of nicotine, because from what I understand, nicotine is really the addictive thing in tobacco. I mean, isn't there some benefits of vaping in that respect?
I don't know if we want to look to.
I mean, if you're already hooked on cigarettes and you want to quit, it just seems to me what I've heard, that's something that some people use to quit smoking.
I can take a stab at that. There's no FDA-approved mechanism that would encourage vaping as a method to stop tobacco smoking. Having said that, for those who are able to quit smoking but still retain the nicotine, which is the addictive component of tobacco smoke, there are lots and lots of stories, lots of cases where individuals have stopped smoking but continue to get the nicotine that they're addicted to through the vaping. And while there are harmful residues in vaping, it is less so than in tobacco. So if your only choice was to smoke tobacco or to get nicotine through a device, an electronic device, you would probably prefer the latter. But having said that, there are toxicities in the vaping liquids. There is still the addictive component, which is the nicotine, which I don't believe is highly regulated in the U.S. either. So you can purchase the liquid and not have a clear understanding of what's in it, as it's not regulated.
Yeah, and this ordinance would regulate vaping for people under 21. I mean, people between 18 and 21 couldn't go buy the vaping equipment. Is that?
Yes, it would regulate vaping and vaping paraphernalia.
Well, the benefits of maybe just, some of the benefits, that's probably for people that are hooked really hard.
Yeah.
Not 18 to 21-year-olds. They haven't got hooked that hard yet, but they will if they keep smoking. All right, well, thank you very much.
Thank you,
Thank
Ms.
you.
Kilby. Mrs. Sims?
Thank you, Madam Chair. Just to reiterate some of the comments made by my colleague, Councilwoman Mosley Samples, were many of the things that we talked about. And I go back to, it's not really, I don't think that we disagree that smoking is a problem, but we have to be mindful to talk about some unintended consequences. And those certainly become very surface for us, me particularly in the community I grew up in, and being an African American. This to be quite frank, sometimes good policies, if these questions are brought to the forefront, become really poor policies for some folks. So I appreciate it, but I wanted to let her be assured she wasn't living in some silo somewhere, that those were concerns shared by myself and others who are around this horseshoe. Again, thank you for the time that you took, and I look forward to providing some insight to how I think the legislation could be made more beneficial to the particular group that we're targeting. So thank you.
Again, I thank you so very much for the work that you've done, the research, and I thank you very much for presenting it to us. Again, I can see nothing but good things from this personally, and keeping them out of the hands of young people, and we're not targeting the users. I think people need to leave here with that information, that we're going after the retailers to make it more difficult for those individuals to purchase. So thank you very much.
Thank you.
Is there anything else to come, excuse me, ma'am, is there anything else to come before the committee? Hearing none, can we have a motion for time? I don't think we, well, we'll just, motion for time. Thank you. Okay, and we're now adjourned. Excuse me, are you here from?